Good morning, everyone, and welcome to Parkinson Society Southwestern Ontario's January 2026 webinar, The Ins and Outs of Communication and Swallowing with Parkinson's. A medical disclaimer is included for this presentation. The information provided in today's webinar is for the purpose of health education and is not intended or should be intended as a substitute for professional medical advice, diagnosis, or treatment. Consult and review the information you learn in today's webinar with your physician or qualified healthcare professional regarding your medical condition and treatment before undertaking a new healthcare regimen. This information is not intended to replace medical advice offered by physicians. We are pleased to welcome today Melissa Vincent, a speech and language pathologist with Bay Shore Therapy. She is an experienced speech and language pathologist with over 15 years of clinical expertise across acute care, long-term care, and community rehabilitation settings. She is passionate about providing evidence-based assessments and interventions for individuals with communication, voice, cognitive, and swallowing disorders. She is also fortunate to be trained in Speak Out, Louder, Clearer Parkinson's Voice training programs used by Parkinson Society Southwestern Ontario. Through her multifaceted career, Melissa is recognized for her compassionate approach, collaborative leadership, and dedication to helping individuals enhance their quality of life through improved communication and swallowing function. So without further ado, may I present our presentation today. Welcome, Melissa.
Good morning, everyone. As Sam mentioned, my name is Melissa Vincent. I'm a speech pathologist. I work primarily in the Windsor-Essex area. I don't know, some of you may have seen me present previously. I've been at some of the PSSOs over the years. So today our main focus is going to be swallowing and voice. So as Sam mentioned, please, if you do have any questions throughout, put them in the chat. Try and keep them in your brain as long as you can. I'm happy to answer them at the end. Just to kind of keep the flow of the presentation going. I'm a pretty casual speaker, so you're going to probably see me kind of refer to my notes a little bit. I tend to, kind of interject and put some personal examples in wherever I can. But like I said, hopefully you enjoy what I have to say today. So I'm just going to kind of start off briefly with some facts about Parkinson's. A lot of you probably already know. This is a disease that affects both the voluntary and involuntary or autonomic system by disrupting the brain signals, largely due to that dopamine producing neuron, right? So when we look at the different systems, the voluntary system, or that motor system or motor control, that's going to affect things like walking, talking, grasping objects. So this is where it kind of comes into play when we're looking at voice and speech and communication. This kind of disrupts the brain's ability to coordinate movements. So you end up with that slowness, sometimes that initiation difficulty, like trying to get out of a chair or start a movement in an exercise, that rigidity, resting tremor, and then some postural instability, so affecting balance as well. So when we look at the non-voluntary systems, that is the autonomic nervous system, which manages involuntary or autonomic bodily functions. So some of the functions that are affected, the cardiovascular, which is basically that orthostatic hypotension, so which is that sharp sudden drop in blood pressure when you're getting up, that can lead to dizziness or lightheadedness, and sometimes even fainting. And then gastrointestinal dysfunction, so that would be like that sluggish digestion, sometimes leading to chronic constipation, as well as some swallowing difficulty, because as we know, it's one big system, right? So if nothing's leaving, there's not a whole lot that wants to go in, right? So constipation can absolutely affect your swallowing function. Temperature regulation. So this is to do with obviously controlling the body's temperature. Excessive sweating can be the case sometimes, often when occurring in like an ambient temperature. So you don't even have to be somewhere that's hot and all of a sudden you're starting to sweat. And then that loss of autonomic movement, or automatic movement, I should say. So that's the reduction of that normal behavior that occurs without thinking, such as blinking. Okay. That can sometimes lead to, I'm sure you've heard the term masked face. So that inability to kind of make the face move the way you want to in regard to your emotion. Okay. So what's the difference? So voluntary versus non-voluntary. So the voluntary control degenerates resulting in slowness, rigidity, and difficulty starting or completing intended actions. The non-voluntary control, that's more causing bodily processes. So that's, like I mentioned, your gut, your bladder, your heart, to slow down or fail to adapt to changing needs. Medications, so I'll just kind of briefly touch on that. While medications like levodopa are highly effective at treating the voluntary motor symptoms, such as slowness, rigidity, and tremor, they often have very limited to no effect on those voluntary symptoms. All right, so now we're going to get into my nitty gritty. So this is just what we're going to be talking about today. We're going to be talking about speech, voice, and swallowing. So you may have heard the term dysphagia, which is basically means problem swallowing. Okay. So dysphagia can be caused because of that like rigidity or that inability to kind of move the muscles flexibly where you need them to be able to swallow, say, like a solid food. The esophagus, which is the tube that takes your food from here to your stomach. If your bolus or what you've swallowed is too big, sometimes it can get stuck in there, because the expansion of that little tube isn't good enough to accommodate what you're swallowing. So that's why a lot of the time, if you've ever met with a speech pathologist, we talk a lot about making sure you chew your food a lot or starting with your food already cut up really small. Ultimately, we want it to be smaller when it goes in, so it's even smaller when it goes down. Okay. Nutritional inadequacies sometimes can contribute to fatigue and exhaustion. So obviously, if you're not feeling like you want to eat or you don't really have much of an appetite, that can obviously affect your overall fatigue and how you're able to do things, because you don't have that nutrition coming in to then pull from to use that energy going out. Okay. And then salaria, which is excessive drooling. This can sometimes be experienced as well. And it is kind of interesting because it can conflict with the fact that you have a dry mouth. So even with dry mouth, we can experience excessive drooling, which absolutely makes no sense, but that's just unfortunately what we sometimes will see. So there's lots of different options as far as dry mouth aids and things like that I'm happy to kind of share at the end as well. If that's something that you're experiencing. Hypokinetic dysarthria. So that is essentially characterized by that decreased voice, that volume, monotone, mono-pitch speech. Sometimes it can mess with your articulation. So sometimes the sounds come out a little bit distorted or imprecise. And then also the speech rate. So your rate can get very fast or rapid, which makes it a little bit harder to understand the speech that's coming out. Speech also can turn into very hoarse, kind of breathy or harsh speech. And this is as a result of how your vocal cords are moving, secondary to that diagnosis of Parkinson's. Okay. Reduced mobility. So this is, again, restricted range of movement, and having that limited control as far as movement of muscles, controlling your respirations or your breathing, which affects your phonation, the ability to produce sound, and the resonance, how your sound comes out, and then that articulation, which I mentioned before, how to produce those sounds. Okay. And then in the very advanced cases, sometimes we don't talk at all. So we have to then rely on what we call supported communication, which then encompasses the nonverbal things. So like writing, gesturing, using pictures, all of those things can be considered communication and very helpful if you're not able to communicate your message verbally. So when we look at speech and voice, a lot of the time we're looking at a decreased or low volume. So if you've ever participated in any kind of speech therapy or voice therapy with an SLP, this is typically kind of the number one of what we're targeting is that low volume or decreased volume during conversation. And some secondary things that kind of accompany that is difficulty finishing the sentence. And like I mentioned earlier, that has a lot to do with the respiration or the breathing. So if you can't really take a good deep breath, sometimes it's hard to get the speech out because you run out of air. Another thing is coordinating that breathing with your speaking. So you might have a good deep breath, but then all of a sudden you're halfway through your sentence and your air runs out. And that has to do more with being able to coordinate your breathing or your exhale with what you're saying. Okay. Difficulty saying certain words. So that relates to articulation. So some sounds are obviously going to be more challenging than other sounds. And sometimes that can result in unclear speech or difficulty saying those particular sounds. The rate of speech I mentioned, that can be a result of going too fast. And what happens is when you go too fast, your speech kind of gets smaller and becomes a little bit mumbled. And that becomes very difficult for your listener to understand. So we work a lot about getting big, opening your mouth, trying to over exaggerate your words and sounds, and that helps to increase the clarity. Monotone voice, so kind of losing that pitch change or that inflex when you're, asking a question, or say you're even excited about something. Usually your voice will change, indicating to your listener that you're asking a question or that this was something that you were really excited about, but instead kind of that monotone pitch that doesn't change. Flat facial expressions. So again, we're talking about that masked face. So that has a lot to do with the expression of your face. So, like I just did with opening your eyes really big, having a big smile, your cheeks kind of going up when you're excited about something, or, even when you're like nervous or frustrated, using those facial expressions to convey that. And sometimes those aren't necessarily working well or at all. Possible lapses in memory or difficulty expressing idea. So this can relate to, you have a topic that you want to talk about, but all of a sudden you're thinking about it and then it just disappears, which can be a very frustrating thing. And obviously, in turn, makes it difficult to express your ideas, because when the memory isn't there of what you wanted to say, now that idea is gone. So what can you do? You want to decrease background noise, because if your volume is decreased, the louder your environment, the harder it's going to be for others to hear you. You want to get close. So when you're talking to somebody, you're not going to be yelling at your wife or your husband in the kitchen trying to get their attention for something. That's not going to be very functional. So you want to have some kind of tool. I've had people that have maybe used a bell or had some kind of signal that they have with their spouse to get them to come closer, so that way they can have a conversation face to face. Attention, that kind of falls into that as well, making sure you get someone's attention. So whether that's like waving at them or doing some kind of gesture or cue. I have some couples that, maybe they'll just do like a slight pat on their leg or something like that to get them to turn, so that way they can share their message and it comes out and everybody's able to hear it. Writing it down. I do know that writing sometimes becomes challenging as it becomes a little bit smaller and more difficult to read. So this is not necessarily an option for everyone, but we also do have the benefit of technology now too, where you can type or use texting on a phone, which can sometimes be easier than writing it down. Breath. Breath is very important. So breathing, coordinating, speaking, exhale, all of that is kind of intertwined to getting your message out. If you don't have good breath, you don't have a good voice. So that kind of is key to being able to project your voice and get that volume that you want. And when we're working on over exaggerating our sounds, we need that breath behind us, because it's more effort. And the more effort, the more breath you have to have. Okay. Same would apply for going slow. When you're speaking slowly, you need more breath to do that. You need to incorporate more pausing into your speech. And that way it comes out clearer when you're speaking clearly, over articulating, pausing more frequently, and taking nice deep breaths in between. So this is continued using that strong voice, like I said, pausing, and then that clear view, getting in front of someone to make sure they can see your lips. That was something that I realized very strongly during the mask wearing time, was that I read lips all the time and my hearing is completely intact, but it's just something that I do out of habit. So when I lost the ability to read someone's lips, it became very challenging to get their message. So that's why that clear view is often very important, because whether you realize it or not, you're probably reading lips as much as you're listening to that message, because we tend to take all the cues that we can when we're communicating with someone. And as I mentioned too, shorter sentences. So that kind of comes with pausing more frequently. You want to make sure you're taking those shorter sentences to keep that clarity intact. And then keeping track. So this is a little bit more challenging. And what I mean by keeping track is trying not to repeat our message. So often we want to try to express that message clearly, concisely the first time, and then we don't want to have to keep repeating ourselves. So some of the things, you can find a speech pathologist in your area who can provide you with strategies and vocal practice. You can join a Parkinson's group. Often Parkinson's groups, I know at least in our area, will often have speakers come in who will do like voice practice or do like a quick session to kind of demonstrate how to do things. And then sometimes if you're lucky too, they even offer those voice programs through the Parkinson's societies. So that would be great if you can connect with the group as well. Speaking with intent. So I don't know how many of you are familiar with the Speak Out program. That was created following LSVT, so the Lee Silverman voice treatment. So Speak Out is from the United States, but their whole goal in their program is to speak with intent. So when we talk about using intention of our message, that's what we want, because our message is important and we want others to hear what we have to say. So using that intention when we're speaking is ultimately the goal to get that message heard. So what can the caregiver do? You want to give the person speaking your full attention. You want to encourage the person to speak louder and with intent. You want to try to avoid interrupting the person, as this makes it more difficult to remember the original message, okay? Let them know that you understand the message or when you don't. So if you didn't understand that message, don't just smile and nod and be like, yep, because that's not doing anybody any good. So ultimately kind of saying, I'm sorry, I missed that. Could you just repeat that for me again? Is a good way of kind of telling that person, oh, I didn't catch it, but you're not like, oh, I didn't get it, tell me. So you want to kind of do it in a gentle way so that way nobody's getting frustrated on either side of the conversation. So where can you practice your voice? So you can find a local speech pathologist for voice therapy. The Parkinson's Voice Project, which is the original etiology of Speak Out, they have a website that you can go on. They have regular online practice. Sarah Odd is another speech pathologist. She has Get Loud Therapy. So that's on YouTube. She has a whole program that you can connect to. And they have regular practice as well that addresses all of the things that I've mentioned, including, facial masking, articulation, voicing. Speechflix.net is another great resource. They have all kinds of different things on their platform as well, including voice. And then dentsu.com. This is also a therapy program that I believe is a little bit newer, and that is a virtual platform as well. Okay, so moving on to swallowing. So there are 3 stages of swallowing, or 3 phases. It is important to know each step and how it affects your ability to eat and drink. So your oral phase is exactly what it sounds like. It's your mouth. The pharyngeal phase, here, your throat, and your esophageal phase, again, from the neck to the stomach. That's the tube that takes all the food down into the stomach. So when we're looking at, sorry, I'm just go back. When we're looking at the oral phase, the things that we're looking at are difficulty chewing. So this is chewing food or liquid falling out of the mouth. This is the ability to control food. So are you able to kind of move the food around in your mouth, or is it getting stuck like in your cheeks or kind of in between the gum line and your teeth? And also moving it from front to back. So are you able to use your tongue to propel what you've chewed up or that liquid from the front of your mouth where you put it in to the back to begin the pharyngeal phase of swallowing? So the pharyngeal phase is the actual phase of swallow. So this is where we focus on protecting our airway. So when that material comes down into our throat, the function is we have a little flap called the epiglottis that covers over the airway during the swallow, protects our airway from getting anything into it, and kind of deflects the material down into the esophagus, which would be butted right up against the trachea. Okay. So if we're noticing vocal wetness, so for instance, if somebody takes a drink and then they start talking to you, or if you even do this, and you all of a sudden feel like a little bit gurgly or almost like you sound like you're underwater, this can sometimes mean that what you swallowed isn't quite cleared from the airway or in and around the airway. So when you notice that, it's always good to try and swallow again before putting anything into your mouth. So we call that like a double swallow to try to clear whatever's there out of your throat or out of the pharynx. When you do this, the reason that this happens is because when we swallow something, the throat or the pharyngeal muscles contract. So they squeeze the material, and that's what propels it into that third phase or the esophagus. Well, we know the muscles change when we have that Parkinson's diagnosis, right? So sometimes those muscles don't tighten the way they need to or contract the way they need to push that material down. So then what happens is some of it will kind of sit there, and you need that double swallow to kind of clear that material out because you can't get it all down in one swallow. Okay. And the esophageal phase, this is affected primarily when we're talking about like acid reflux. So sometimes acid reflux can be caused as a secondary or a symptom of a medication. Sometimes it's just having to do with maybe you have a diagnosis of a hiatal hernia or something that is not allowing that trap door from the esophagus to the stomach to close properly, and that acid is kind of coming back up. And that can be a cause of discomfort. Sometimes you can get pain in your chest after swallowing, and sometimes it creates slower movement of the food or the drinks getting into the stomach. So when we talk about swallowing and how it affects us, we look mainly at changing the food or the liquid consistencies. So if it's, we've been diagnosed with difficulty swallowing, but we've tried some strategies, maybe turning our head, maybe chin tucking, some of the things that you've probably heard already if you've had any issues with your swallow, maybe using a smaller spoon, eliminating the straw, using a different kind of cup. Once we've exhausted all of these different, we call them compensatory strategies, then we move into having to change the solid or the liquid consistencies. So what we do with that, I'm going to explain a little bit as we go on. I have some different pictures kind of showing you the different consistencies. You might need to divide your meals into a smaller, more frequent meal throughout the day. If you're finding that you are getting that discomfort, maybe it is something to do with that esophageal phase. Maybe you do have reflux, and those smaller meals will help to kind of help you with your digestion. Sometimes this helps with constipation as well. But hydration is going to definitely be the key for constipation because you need that fluid in your body to draw to the bowels to get them to move. Be sure you're always sitting at 90 degrees when eating, drinking, also when taking medication. So the last thing I ever want to see someone doing is laying on their side in bed, putting their pills in their mouth and trying to take a drink while they're laying on their side. You have to be up at that 90-degree angle, whether it's you're sitting on the side of your bed, you're coming to the table for your meal and that's when you're taking your medications, but you never want to be in a reclined position or laying down. And then take your time and stop eating if you feel tired. Because if you feel tired and you keep trying to eat, that's when you increase the risk of more difficulty happening. So if you're starting to feel, oh, I can't do anymore, step away from it and come back to it in a half an hour, 45 minutes, and maybe you're going to be ready to start eating again or continuing that meal. That's also where the small meals come in too, because sometimes when there's smaller meals more frequently, you're able to finish them and get more calories. So now I'm just going to talk a little bit about the different textures of solid foods. So this is what a chopped or diced solid would look like. So a lot of the time too, what we see is the meat tends to look sometimes different from the rest of everything because meats are often harder to chew. So there's a lot of cases where I might recommend somebody be on a regular diet where there's no changes at all, but maybe I want them to chop their meat up because the meat has been very challenging. So in this particular picture, the chunks are fairly large for everything, but the meat is cut into like more of what we would call a diced solid. So this is a ground or a minced texture, depending on who your clinician is. That's what they'll say, either ground or minced. Minced is the common term, but this is the type of consistency you cannot create without putting into a food processor. So you can't chop something small enough for it to be considered minced. So it has to go through that processor in order to qualify as like a minced texture. This texture is often given if somebody's having a lot of difficulty chewing or breaking the food down. This helps to kind of eliminate that part. You do still chew it. It does still have texture, but you don't have to. So this is a texture you can just put in your mouth and swallow, and it's not going to affect you negatively, but it also does have texture where you can chew. So then we move on to puree. So the puree texture is a smooth, basically like pudding or applesauce. Mashed potatoes, those all qualify as a pureed texture. Oatmeal is always one that I get the question of, is that a pureed texture? It depends on who you're talking to. So some clinicians will say, yep, oatmeal is a pureed texture. Some will say, no, oatmeal is minced, because you do actually chew oatmeal in a lot of cases. So that is something that, there are some foods that you can kind of weigh on either side, but this is what the puree would generally look like. Then we move on to your liquids. So there are different types of fluids. So when we move into what we call thickened fluids, this is because the regular fluids, so like your water right out of the tap, is moving too fast for that flap to cover your airway before the fluid comes down. And the reason you know this is because either you'll start to notice when you take a drink, you're coughing, or your throat clearing a lot, like you'll take a sip and then those are the result of something kind of tickling or getting in the airway. It doesn't mean that it's gone into your lungs or anything like that, but it just means that it's kind of went in there a little bit and you might have coughed it out, or that throat clear might have kicked it out. But sometimes when it gets to the point where it's becoming more regular or more and more often, then that's where you might need to do the thickening. So there's 4 different levels of thickening now. So there's slightly thick, mildly thick, moderately thick, or extremely thick. I put the other or older terms next to them as well. You might have heard those: nectar, honey, and pudding. We don't really use those anymore. They've been upgraded to the newer, slightly, mildly, moderately. So there's a couple different ways. With a slightly thick fluid, often there are fluids out on the market that you can just use. You don't need to use thickener at all for those. So those would qualify like an orange juice or milk. Supplements can fit in this as well. Supplements can also sometimes qualify as a mildly thick. Again, these are kind of conversations that you would have with your therapist, whoever's recommending the thickened fluids for you. They would give you a good idea of what counts, what doesn't, and they should be also giving you some suggestions or examples. Moderately thick is not a fluid that you can find naturally. You have to use a thickener if you're on moderately thick. And then extremely thick, essentially you're moving into purees at that point. So you're looking at, the consistency of applesauce would now be the consistency of your fluid. Okay. Foods that you would need to avoid, because these foods, when you put them in your mouth, actually melt to a thin fluid. So if you are on, say, a mildly thick fluid, ice cream, jello, popsicles, those types of things might be challenging, and may need to be eliminated from your diet. However, there are certain cases where that does not need to happen, and you can tolerate those things just because of the amount being smaller. And sometimes when it's coming from a spoon rather than a cup, it makes a difference that way as well. So slightly thickened fluids, like I mentioned, are just slightly above thin fluid. So this is basically a fluid that does not require thickener. And I've given some examples there as well. Like I mentioned, the homogenized milk, coconut water is another one, nutritional supplements, drinkable yogurt, cream soups, those all generally qualify as slightly thickened fluids. Mildly thickened fluids, you can kind of see on the spoon there, they leave like a little bit of a coating behind, but they're still very much a fluid, very much will come off the spoon easily. And then these are like buttermilk, some gravies, tomato juice, some sauces, yogurts, custard, things like that, that are a little bit on the thinner side though. And then moderately, so this actually drips kind of in dollops off the spoon. So it's not going to be a consistent flow. It's going to be basically what is called honey. It's going to look like honey. And then this also gives some examples like pureed fruits that are thinned out, tomato sauce. There's a few different things that, like I said, can qualify, but normally these types of fluids have to have a thickener put into them. And then extremely thick, which I mentioned earlier, does not flow off the spoon. This is going to be more like your puree. So that's going to be almost more like a solid at that point. So I just want to mention too. So when you're looking at thickened fluids, as I said, whoever is recommending those thickened fluids to you should be giving you information about how to thicken fluids. So there's Thicken Up, there's Thicken Easy, there's Nestle Thicken Up Clear. There's a lot of different options to thicken your beverages. And if you have questions about that, I'm happy to share them at the end as well. So this here, these are some problem foods as well. So we call these dry or crumbly particulates. So these, for instance, are going to be like very dry foods, small part like rice, popcorn, nuts, bacon bits is another one. Those are the types of foods, crackers that crumble. Those would be your dry or crumbly particles. Mixed consistencies. So you might hear this at some point as well. This can be often very confusing. I've run into this a lot in retirement homes, not really understanding what a mixed consistency is. So basically what that is a solid floating in a liquid. Okay. So that would be like chicken noodle soup. That would be your fruit cup with juice in it. Cold or dry cereal floating in milk. So it's anywhere when you put that bite in your mouth, you're getting a solid and a thin liquid at the same time. Okay. That's what a mixed consistency is. So what would the role of the speech pathologist be in the matter of swallowing? To assess and determine what texture is going to be most appropriate for meals, provide instruction and support for swallowing safety, assess and provide exercises to improve strength and or maintain the current function, and then connect you with the appropriate resources in your community. How can you get your swallowing assessed? So you can always contact Ontario Health at Home. They will sometimes put that service in depending on your mobility. If it is harder for you to get out of your home or you're already involved with Ontario Health at Home, often they'll put that speech pathology service in for you without difficulty. You can hire an individual speech pathologist privately, or you can hire a company. This is a little drop on my company. So Bayshore Therapy and Rehab is the one in Windsor. But there's several different private companies that you can hire to have someone come in and do that assessment for you. All right. And we are at the moment of questions.
Thank you so much for joining us today for our webinar. We look forward to seeing you next month. Take care.